Hi, everyone. Hey, good morning. Buenos dias. My name is Esperanza Cantu. There are many questions I ask myself that result in a yes or a no. The most frequent are, can I do this? Is this right for me? Should I do this? Do I deserve this? And said it another way, can I or do I belong to this or here? And saying yes has never really been easy for me. I'll admit that most of the time my yeses are, okay, I guess I can do that. Sure, yeah, I can do that for you. And it usually takes me a long time to answer these questions, and it's painfully long sometimes. Like, you can talk to my husband, Micah, when he proposes what we should eat for dinner, and I hesitate in answering yes or no. True story. So my mom says this thing about me, and she says, que terca la mula. And so she's basically calling me a stubborn mule. And so in this context, the best way that I can describe it is kind of standing at the edge of the water. And so I grew up in the Rio Grande Valley, and so we went to South Padre Island a lot as a kid. It was an hour away, and it was the cheapest way for us to have fun as a family. You'd pay $2 or $3 to park at the beach, and then you could stay all day and have lots of fun. And it's salt water. So I live in Michigan now, and so all the beaches are fresh water. And so it always took me a while to get all the way into the water, except for my feet. And so living in the Rio Grande Valley gets really hot and can get up into the 100 degrees Fahrenheit numbers. And when you park at the beach, it's basically like a race to the water because the concrete is hot, and it doesn't really matter if you're wearing shoes because when you run in the sand, you're gonna sink. And it's really hot and it's blinding, and you just wanna get into the water. So there I am, like, imagine, little Esperanza kind of like running to get into the water. And I'm usually carrying a towel, and sometimes I had the unfortunate job of dragging the ice chest. Because we were a big family and we usually went with extended family, we were like sinking in the sand, trying to drag this big ice chest and failing. And so burning your feet. And so it was always really nice and relieving to get my feet into the water. And I find myself doing that a lot professionally and in my personal life, where I put my feet in the water and I just kind of stand there. And I wait, and I think, and I pause, and I question, and I wait. And the salt water, crashes along my ankles, and the seaweed tickles my toes. And sometimes, if I'm lucky, I see little fish, swimming around. And I see other kids laughing, and I see other kids splashing, and I just stand there, waiting until I'm ready to get into the water. So for me, this kind of waiting is really uncomfortable, and just talking about it right now is kind of like putting me in that place, and I'm feeling a little frozen. And I don't want to be the person who hesitates. I want to be the kind of person who jumps in without waiting. And what I've come to learn through this year and through this fellowship is that in reality, I'm already in the water, right? With the waves coming in and out, the salt water that if I'm unlucky and I shaved that morning, it's stinging, right? And so I know it's there. It's actually rising, right? And so regardless of whether or not I make the choice to go in or out, I'm in already, and this water is rising. And so my mom, my dad, my siblings, they're splashing water on me, and they're saying, come into the water, and I'm standing, and I've got sunblock on, but I'm still standing. I'm still outside the water, really. But without knowing it, I'm already in it, right? So yes, I've come to learn that I do say yes, as uncomfortable as it is to say out loud. Yes. And that's probably why it's so uncomfortable, is because I have all this self-doubt and continue to say yes. So I'll tell you a little bit more about myself to explain. We talked a little bit about identity for all of us throughout this fellowship. And I started questioning my own personal belonging as a kid. So where I grew up in Monte Alto in South Texas, I really feel like I stood out. And so in a sea of beautiful dark brown skin and dark, straight, long hair, there was what I felt like was me. And I, was light complected. I had this like fuzzy, frizzy hair that I didn't know how to take care of. And so I'd brush out my curls. And so it was this huge head of hair that my brother liked to tease me and call me lightning head after gym because, because it just, it went everywhere. And in my Mexican-American family of 6, I was the only child who my parents gave a really Spanish-sounding name. So my brother's name is Edward, my little brother's name is Andy, and my little sister's name is Megan. And I'm Esperanza Felicidad. And my parents' names are Dorothy and Edward. And so I really struggled with this. I was also the only sibling of mine who actually left the state of Texas for college. And I was the only one who outwardly struggled with mental health. So like my mom, Dorothy, I used to struggle with panic attacks. And I've shared some of this with you all before, but when I was in high school, my mom really was that rock for me, and she guided me in my recovery. So when I was crying and I felt like I couldn't breathe, she'd welcome me into her warm bed, because this usually happened at night. So she'd welcome me into her bed, and she'd rub my back and my neck, and didn't say anything. She didn't have to say anything, but just helped me feel safe until it passed. And when that didn't work, my parents, both of them, would take me outside. And so I don't know if you've ever spent a night in Texas, but it's beautiful. And where we're from, it's very rural, so there's not a lot of lights. And so the Texas stars would kind of light up the sky. We had an incredibly strong south wind, and so you could hear, the sugar cane kind of crashing into each other as the wind came and left. And I often was shocked because I'd kind of forget that we had dogs, a lot of outside dogs. And so they'd kind of come and run up to me and they'd jump on me. And a lot of times that would kind of snap me back into feeling safe and present and grounded in where I was. And so it wasn't just my family that helped me through these tough times. It was my teachers. My mom was a teacher in high school, and so everybody knew my mom. And so I had a lot of support in school, and then we were very faithful in going to church. And so we had a lot of people in our community and then in churches, and not just in our town, but in the next town, who, if they saw me struggling, they would help me. And so it wasn't the same for me when I was in college. Without the support of my family, without the support of my Tejano culture, my background, my community, I really struggled. I chose to go to a predominantly white college, and when I was there, that was the first time I saw a bagel. Okay, I was 18, tortillas for life. Every time I interacted with people, I just felt out of place and really different. And I saw that people acted different. Where I'm from, almost everybody was Mexican American, and something about Latinos is we come in all shapes, colors, tones. And so it was really strange for me to see people segregate and separate into groups. In my hometown, we spoke English, and we spoke Spanish, and we spoke Spanglish, and nobody batted an eye about switching back and forth, and that was also really hard for me in school. And I don't tell you these things so that you feel sad for me, but I tell you to help paint the picture of how this has kind of changed me and helped me be who I am today. It was cold, school was hard. I graduated second in my class in high school and thought I was gonna drop out of college because it was just so hard for me. And I know this is not a story that just I experienced, but I know so many people struggle with issues like this. I stopped going to class, and I dropped a couple of classes, and I struggled without my support system, not just in my personal life, but in my school life. And so looking back now, I realized that it's not just the panic disorder that I was struggling with, but it was really culture shock. And even when I was in school, I talked about having culture shock, but didn't really feel it the way that I feel it today and understand how it worked. I wasn't used to feeling so unwelcome. And it's not that people always intentionally, said something to me or treated me a certain way that had me feel unwelcome. It was just, I'd have these interactions that, just had me questioning people's intentions when they talked, when they looked, when they gestured. And so that was really a challenge for me. So I started taking classes in the social sciences. So when I was in college, I studied biology and decided to kind of venture out and start taking some more anthropology and sociology-based classes. I had a research internship also, and it's funny, when you have experiences, sometimes we learn and sometimes we don't. And sometimes we read things and then it causes us to reflect on what we see in the world around us. So I remember having an internship and learning that that Black and African American and Latino men were diagnosed and unfortunately died from pancreatic cancer more so than white men. And that was like completely bonkers to me. That was crazy to me. I didn't understand why or how that could work. I had, grown up in a place that was really pretty sheltered. So all of this was really new and different to me. And so I started taking classes that focused more on racism, and I started taking classes more focused on public health. And it brought me to pause, and I wondered about my own personal health challenges that I faced. And I looked around at my family, and I saw obesity, and I saw diabetes, and I saw heart disease, and I saw, my family members dying really young. And, I think about, my grandparents on my mom's side and my grandpa on my dad's side, and I have, several uncles who have passed, I think, before their time, and several cousins who have passed before their time. It just all of a sudden kind of came to me as a shock that I was seeing these things. And I had this experience where I learned that racism is not really just like how we're treated, but it's something that really gets under the skin. Right? And it affects our health, it affects our quality of life, it affects how long we live. And it's this evil thing that seeps into the wombs of our Black and African American sisters, and it affects their children. It's in this post 9/11 era, and with our current political climate, we're starting to see it also affect the babies of Latina women. We're starting to see it affect the babies of Arab American women. And I am 100% sure that it also affects the Native and Indigenous people of everywhere that have been colonized, right? This seems like a universal truth to a certain extent. And so in public health and in the hearts of those of us who are here in the room today, we know that racism doesn't just affect these groups of people, it affects all of us, and it affects us for generations. So in our society, our health systems, our public health systems, these systems of care that are actually supposed to care for us, they don't actually work for everyone in the same way. These power dynamics of who belongs and who doesn't, who has power and who doesn't, and who participates and who doesn't. It affects our DNA, right? It affects the things that we cannot see above our skin. So what we need is not just power, but we need representation and we need participation. We need a public health system that is welcoming, a system of care that actively shows us that we all belong. And when I think about it this way, I'll ask the question, is belonging kind of the opposite of racism? So in my most recent job in local public health, I was responsible for building a community health improvement plan. This was something that we were working with multiple community partners on, and it was going to guide the health department in helping to improve the health of residents of the city of Detroit. And this really felt like it was something that I was made for. I thought about my experiences and I thought about my education and training, and I said, this feels right. And importantly to me, it was something that would give residents an opportunity to actually participate in the planning of their own health and safety, that planning and participation piece. It was good for my values of voice, family, and community. When I said yes to this fellowship, I didn't actually know all of the lessons and experiences that I would have, and I especially didn't know about all the tools, really, that I would start using in my own life. But in this fellowship with you all, I learned about the importance of narratives, of stories, and of why we belong to this work and why it belongs to us. In this job, although I had all these things that I was really excited about, I didn't really feel like I had that bravery, that authenticity, that vulnerability they're really part of my core values as a person. And I didn't have an opportunity to live them. So don't get me wrong, I'm not comparing myself to these wonderful people. But Reverend Martin Luther King didn't say, let's build a plan. He invited others to dream with him. Cesar Chavez and Dolores Huerta, they said huelga, which means strike, and they invited people to build a union. Nobody built a movement by saying, let's build a plan. So in helping to build this plan, I wasn't bringing my whole self into my work that I loved so much. I struggled with the culture. I struggled with the infrastructure of how decisions are made in local public health. And even though it seems like I said no to public health by leaving my job, I actually was saying yes to myself. And I was saying yes to public health in a very different but freeing way. I said yes to vulnerability, and I welcomed coaching into my life. If Kate were here, she'd laugh with me. I said yes to travel and the pain, hope, and humanity and Ubuntu that we all experienced. I've said yes multiple times to myself just during this talk with you all here today, just by opening up. Many of you know I said yes to new family and friends and love, and I welcomed my first daughter, Maitea. And we're really excited that hopefully we'll welcome our next daughter at the beginning of next year. We said yes to Detroit, which is a city that has given me so much and affirmed me so much in my life. And I'll add a side note here. Don't listen about the narratives about Detroit coming back or bouncing back, because Detroiters have been saying yes and fighting for themselves for decades, and there are plenty of other people who'd be happy and strong and willing to share that with you that I can connect you with. They can tell that story way better than I can. So yes, it turns out that I say yes to myself quite a bit. Just like you all, I deserve to share my voice and my story. And now I know in my bones and in memory of Fitz that it's also a responsibility. Gloria Evangelina Ansaldúa said, "Caminante no hay puentes, se hace puentes al andar." Voyager, there are no bridges. One builds them as one walks. We are stories and we are bridges. And we are bridges on this journey toward health equity together. So, I invite you to say that tiny little word with me once. Yes.
Yes.
Can we do this?
Yes.
Should we do this?
Yes.
Are we made for this?
Yes.
Is this right for us?
Yes.
Do we deserve this?
Yes.
Do we belong to this?
Yes.
Does it belong to us?
Yes.
Ándale. Tell your stories. Bring people along with you. Do the scary thing that's unknown and say yes, even if it means failing forward. We might not have screamed yes to all these things that happen to us in our lives, but these lives have chosen us. We're already in that salty water, and it's rising. Be bridges and welcome it and be grateful for all of it. We belong to this work, and it belongs to us. So, adelante. Thank you.